Hello, everyone.
This is Jenny Kluznik.
And this is Kathy Berlin. And we would like to extend a warm welcome to those who are joining us today and those of you who will view this recorded webinar at a later date. Acknowledging the countless tasks on your academic to-do list, we are grateful that you were able to find time in your busy schedules to join us for this webinar. We begin with honor and respect for the land and for the first people of this land. We are on the ancestral homelands of the Dakota people. We desire to honor and respect the first people and recognize their caring for our common home. Other sovereign American Indian nations, including the Anishinaabe, also have a long history with these sacred lands, past, present, and future. We, both personally and collectively, continue to have a deepening awareness of our complicity of the complex history of colonialism, genocide, and broken treaties. We seek to understand the troubled acquisition of this land by unjust U.S. government practices, including the stealing of these lands and the forced removal from the birthplace of the Dakota people without any compensation to the American Indian communities. We acknowledge the past, current, and future impacts of this history on our relationship with our American Indian sisters and brothers. A few notes for you before we get started. This webinar is being recorded and will be placed on the EPR Curriculum Hub. The Curriculum Hub, upon its completion, will be a free and open source for emergency preparedness and response content and curriculum. We look forward to engaging with those of you who have joined us today and will do so during the Q&A portion of the webinar, which will follow the presentation. That being said, feel free to add questions via the Q&A window during the presentation. We are joined today by faculty from the Minnesota Private College Council member institutions, our partners from the Minnesota Department of Health, and representatives from the Minnesota State Colleges and Universities. Again, we're glad to have you with us.
As we get started, we wanted to start and share how this webinar and the subsequent webinars in this series fit within a larger project focused on emergency preparedness and response. Specifically, the two goals of this project are the result of a grant, which we'll share more about, but specifically looking at enhancing curriculum within Minnesota Private Colleges Council member institutions in public health emergency preparedness. And secondary to that, in addition, also showcasing and highlighting careers and options in emergency public health and response for students. And there are several projects, including this webinar series, that fall under that project to meet those goals. And one of them, as Kathy highlighted, is building a publicly available online resource hub for EPR content and curriculum, and really focused and with a deepening understanding with a health equity lens within this curriculum. In addition, it's working with member institutions, faculty, and staff of utilizing the hub and supporting curricular implementation. In addition, there is an opportunity for subgranting for faculty and staff among member institutions to advance the goals of this project and to support work within those colleges and universities. Our work is also being guided by an advisory group, which is comprised of 7 faculty members from member institutions and really provides expertise, guidance, and input on our work and activities within this project. So as we get into the content for today, we wanted to highlight the overall session objectives and then offer some next steps at the end of this webinar and an opportunity to engage in questions and answers. The first is we want to provide an overview of public health emergency preparedness and response. And we recognize that this is a specialty, it's an emerging field, and it's is a very complex and in-depth field, and our goal is simply to provide an introduction. We also want to discuss how we can integrate health equity as an integral component within EPR-related curriculum and provide some examples, especially using the FEP capabilities, which we'll define for you. And then the final piece is offering some ideas and ways forward, and maybe even building on your current work about integrating content with both undergraduate and graduate public health and health-related programs.
This webinar in support for the overall EPR project is supported by grants from the CDC and is being administered by the Minnesota Department of Health. As project consultants, Jenny and I share a longstanding interest in public health emergency preparedness and response. Jenny, as faculty at a few of the Minnesota Private College Council member institutions, and myself as a public health professional involved in EPR, or emergency preparedness and response, at the local public health level and at the University of Minnesota. We believe our combined 32 years of EPR experience, coupled with our commitment to supporting faculty, staff, and students in the realm of higher education, will result in a robust, publicly available online EPR curriculum hub and an enhanced learning experience for students interested in public health. Once the curriculum is available on the hub, we have no doubt faculty committed to including EPR content in their courses will provide students with the opportunity to not only learn about EPR, but also consider joining the EPR public health workforce.
So with beginning an introduction or grounding in a field, we wanted to offer some definitions, as well as how thinking about offering definitions at the start of introducing students to emergency preparedness and response within public health can help set the stage for learning experiences going forward. So the first three that we wanted to offer definitions for is looking at disaster versus emergency versus hazard. These definitions currently highlighted come from the FEMA, and specifically when we look at a disaster, you can think of it as a serious disruption of functioning of a community that can be from a natural disaster, technological, or human-caused event, and it has some significant impact on community as well as health outcomes. An emergency is defined by any incident, whether natural, technological, or human-made, that requires a responsive action to protect health and well-being of communities. And with falling under that, there's also a public health emergency, and this can be a type of event or imminent threat to human life and well-being that produces some range of health outcomes depending on the incident being described. Also, we offer the definition of hazard, as this is something that offers a potentially dangerous or harmful, and the root cause is an unwanted event. Within the scope of emergency preparedness and response curriculum within public health, there are definitions for these different areas that slightly vary based on the entity. For example, if I'm teaching global health students, I might feature a definition from the World Health Organization and offer a comparison to other entities. We also have definitions for some of these things within state and federal legislation that offer some ways to examine and explore. Disaster and emergency can be, and you may see used interchangeably within descriptions and the literature as well. We talk about hazard as well, and defining hazard within the context of all hazards planning. An all hazards approach to planning is an integrated approach within emergency preparedness planning and response that involves certain capacities as well as capabilities in the field that are critical to the work. The next definition we wanted to set forward is, what is public health emergency preparedness and response, and how do we go about defining that and then working with our students to build out curriculum to enhance their learning in this area? We offer this as a modified definition from the Center for Disease Control FEP capabilities that focuses on the field that includes planning and response to the public health consequences of both disasters and emergencies. And if you look to the right of the slide, that this represents the cyclical process of where we see a public health emergency preparedness and response. There's a disaster and there's an immediate response that occurs. There's a recovery phase, but we also look at the continuum of response that includes prevention of future disasters and emergencies, mitigation, as well as preparedness falling under this field. Also within our work, we've come with a greater or more nuanced definition that includes from Nelson et al. In 2007, offered that it's both the capability of public health and healthcare systems, communities, and individuals that work to prevent and protect against the health impacts of health emergencies. So then we ask, what is the next, when we look deeper within this field, what is public health's role? And we come to some of the frameworks and capabilities moving forward.
The guidelines and frameworks listed on this slide serve as a scaffolding of sorts for the creation and development of the Resource Hub. These and other resources such as FEMA, the Administration for Strategic Preparedness and Response, known as ASPR, and training sites such as MinTrain offer dozens of training modules, fact sheets, videos, and toolkits, all of which we are vetting for inclusion on the Hub. It's important to note here that health equity is a central component of the 10 essential public health services, as well as several of the resources Jenny and I have found, which is fantastic in and of itself, and a bonus in that it aligns with one of the grant project objectives identified by the Minnesota Department of Health. In 2011, CDC established 15 public health emergency preparedness capabilities that serve as a national standard for public health preparedness planning. Since then, these capability standards have served as a vital framework for state, local, tribal, and territorial preparedness programs as they plan, operationalize, and evaluate their ability to prepare for, respond to, and recover from public health emergencies. The FEP capabilities were updated in 2019 to reflect expanded strategies that plan for disproportionately impacted populations. Jenny and I are utilizing these capabilities to inform the inclusion of each potential curricular resource during the Hub vetting process.
For the next few slides and returning later in the presentation, we want to introduce you or revisit for some of you some of the FEP capabilities and specifically provide examples of curricular elements that align with the FEP capabilities and provide in-depth learning experiences around these capabilities. The first we wanted to highlight is that of community preparedness. Definition of when we look at community preparedness under the FEP capabilities is the ability for communities to prepare for, withstand, and recover from public health emergencies or disasters. This involves coordination and engagement across professions and across public health systems, both at the state, local, and tribal entities as well. Some of the actions or items included under this capability, but not inclusive of everyone, can include looking at and supporting the development of public health and healthcare systems, mental and behavioral health services, and environmental health systems. From a student perspective, this comes from gaining a foundational knowledge of what's included in these systems and the elements and entities included. There's an element under this capability of looking at how training happens at both the prevention, responding to, and recovering from emergencies and disasters. In addition, it looks at promoting awareness among individuals, communities, and stakeholders and entities working in the field of awareness and access to resources in the event of public health emergencies and disasters. And finally, it also looks at addressing access and functional needs. So being able to determine risk to health within a local area. So needing skills of how we look at and work to strengthen community partnerships and responses in these events.
Medical countermeasure dispensing and administration is the ability to provide medical countermeasures such as vaccines, antiviral drugs, antibiotics, and antitoxins to targeted populations to prevent, mitigate, or treat the adverse health effects of a public health incident according to health guidelines. Here's an impressive example of medical countermeasures administration you could share with students and possibly use it as a case study in efficient and effective medical countermeasure administration. In less than a month in 1947, New York City vaccinated 6 million people when there was an outbreak of smallpox, with thousands of volunteers aiding them. Healthcare providers administered as many as 8 doses a minute, which is quite impressive. We can look at the COVID-19 vaccination campaign as an example of how public health took the lead in finding and arranging for the delivery of the vaccine, identifying large public spaces where people could line up to get vaccinated, as well as gathering and training the workforce needed to efficiently, safely, and effectively run a mass vaccination site.
The third capability we'd like to highlight is that of public health surveillance and epidemiologic investigation. And this involves just that piece of the skills involved in epidemiologic investigation around outbreaks of diseases, injuries that may have occurred, or exposures. And this can provide a range of skills for exploration for students and opportunities for learning, activity, and curriculum. So this includes understanding the components of descriptive and analytical epidemiology, of being able to construct case definitions, also skills in data collection and analysis methods, and some foundational work in disaster epidemiology as a specialty of maybe how to utilize certain toolkits, such as the community assessment for public health emergency, or what's called CASPER, or an assessment of chemical exposure programs toolkit. Under this capability also includes work to support local public health or local entities within these these events. In addition, this can be building understanding of surveillance systems that are existing, or how to build new surveillances that might be needed. Another element of this capability is sharing information both with communities, stakeholders, and partners as a result of investigations and ongoing support. And so building and looking at skills and communicating health information, epidemiologic information as key skills that we can look to translate from this capability to the classroom. So the next piece we wanted to talk about is how could, with the capabilities, how else might be opportunities for framing some of these discussions and learning experiences in emergency preparedness and response at both the undergraduate and graduate level, and offer some opportunities, or maybe where your existing work provides the opportunity to do that. One of the first examples we'd like to highlight is framing this within larger discussions or frameworks or discussions around specific impacts of climate change and human health, and the impacts that we see that are wide-ranging. This is a figure from the Centers for Disease Control, which explores the varying of extreme weather events that we can see, and the significant health impact across both infectious disease, chronic disease, environmental exposure, impact of mass migration, all of the components that provide a really diverse way of which we can introduce concepts of disasters and public health emergency capabilities within education. Another framework within climate change and health is a figure from the Center, or from the World Health Organization, that specifically expands on that, both the health impacts that are wide-ranging of climate events and climate change, but also offers the opportunity and framework to investigate and examine and introduce the FEP capabilities from the context of looking at the impacts, if you see on the right slide, or right side of the slide, of the impact of climate change on healthcare systems, on public health systems, when we look at providing ongoing services or immediate services from a major event. In addition, it's the opportunity to also look at some of the vulnerability factors that we can see compounding health outcomes and inequities from climate events, as another framework to begin to introduce the concepts and capabilities within education. And finally, there's a piece of framework and scope of introducing these concepts within the scope of disasters and disaster response. This is a figure from the National Center for Environmental Information, which showcases, or which highlights the billion-dollar disasters experienced in the United States related to weather disasters specifically, and offers an opportunity to explore regional differences in the types of weather disasters that are occurring. In addition, then another discussion of how does that change and how does that differ as far as emergency public health or emergency preparedness and response and planning with different types of climate and disaster events that occur in different regions of the United States. Another element that we recommend as far as how we can frame discussions and encourage discussions is also including a discussion of the health impact of disasters and emergencies by utilizing a framework of outlining different types of disasters that can occur, whether it's human-made, climate, impact of things, everything from war to environmental disasters like an oil spill. There are a wide range of what we can see. So outlining the different types of disasters and public health emergencies, and then aligning that with how do we talk about both the direct and indirect health outcomes that can happen. This also provides a way to scaffold or build curriculum of both addressing the immediate needs of public health emergencies and disasters, as well as then also looking at long-term needs. So we can think about the physical injuries that might happen after an immediate event such as a tornado or flooding or a hurricane, but then also the important pieces of looking at both immediate and long-term when we might take a look at behavioral health or mental health support in communities in the recovery phase after disasters, that offering an opportunity to both explore the types of disasters and public health emergencies and what that can mean both in the short term and long term for health outcomes. And another component of framing, as we've talked about, the health equity lens within the field of emergency preparedness and response and curriculum development. A key element of that is the exploration and discussion of disasters don't impact everyone equally in a community, that disasters can worsen longstanding disparities and inequities experienced by people from low incomes or other communities, such as racial and ethnic minority communities, or communities with less power or access to care and services. One means of introducing this concept to and using as a tool to discussion is the concept of social vulnerability. The social vulnerability can be integrated with planning and response, and specifically the Centers for Disease Control, Agency for Toxic Substances and Disease Registry, or ATSDR, has available what's called the Social Vulnerability Index, which is an index indicator of 16 social factors from the US Census data that works to identify communities that based on a number of factors, such as lack of access to transportation, overcrowding with housing, or lack of potential for financial loss or impact of disasters and public health emergencies that can face a potentially greater risk as a result. That this is another framework to introduce the concept and focus on health equity within disaster planning and response. And finally, the other piece of looking at, especially within capabilities of assessing access and functional needs of communities, that we can look at, especially the needs of people who may have limited English proficiency when we look at communication strategies around public health emergencies and disasters as one example of how we can look at assessing access and functional needs. So a third component for our presentation that we'd like to discuss is what is existing as public health emergency preparedness and response curriculum, as well as what are some ideas going forward that you may be working on or looking for some other avenues. In the start of this project, as we were curating and looking at materials as we continue to do, we turned to a few resources to help frame as we were looking and seeing what's out there. And the first was the literature. We looked at both what is existing in public health programs, other healthcare related professions that have a public health focus. And when we looked that there is some evidence of curriculum that's specifically EPR in a limited amount within master's and graduate level education, and that it's growing among public health programs, but a more limited amount at the undergraduate level. We also see the introduction of public health emergency preparedness and response within the discussions and framing, as we talked earlier, within climate and public health preparedness. And we've also worked with our member institutions to hear what kind of curriculum and activities that are happening within different public health at the undergraduate and graduate program to help serve as a basis and guide too as we move forward in developing the curriculum hub. So we wanted to offer some ideas as we go forward of how could you work if this is an area that you want to expand or build off of what you're doing within your curriculum as both a faculty or staff, is really think creatively about how you want to do this. It could be anything from an elective or a full course dedicated to this to being integrated within one course. And I think using the FEP capabilities as a scaffold or a grounding of looking at skills, knowledge, and content to include can help provide that. So we think about and encourage you to think about what's your goal or objective or area of the capabilities that you'd like to focus as you begin to build out, or if we can help offer resources and support, especially through the hub and you doing that. The other thing to think about under the FEP capabilities is there's a wide range of focus that a single content area within, say, an environmental health course, an epidemiology course, communications, or even health education course offers a rich opportunity to engage in curriculum in this area. Another element we encourage you thinking about is how you can connect with local community. Local public health offers an opportunity for engagement and has great stories and strength, even potential guest speakers to speak of with their experience, or the state health department, or thinking locally too about other community-based organizations that may have some unique perspectives of public health emergency preparedness and response. And as I mentioned before, thinking about the full spectrum of curriculum, that it could be a single event or a larger event, or a campus-wide event, or a full course dedicated to public health emergency preparedness and response. So what are some examples of how we can do this? Offer some ideas to get you started as you start to think about curriculum examples, and maybe you're already doing this. If so, we'd love to hear from you as well as you're doing many of those things. One of the pieces is to think about hosting a career panel of local public health community leaders, and connecting with state health department in the area of public health emergency preparedness and response as a way to showcase for students and offer the opportunity for interaction. The other is to consider developing a single exercise, a workshop, or a session that might be interprofessional, including public health, community health, to work on and talk about public health emergency preparedness and response. We have some really neat case studies that we found in some of our research to share as far as what might be some opportunities for engagement and dialogue within the area. The other piece to think about is also connecting with local Medical Reserve Corps, and this offers a real-life, hands-on learning opportunity both for faculty, staff, and students, but to be able to participate in emergency preparedness and response efforts. And then finally, another opportunity is to consider building off of national efforts. This could be in the classroom, it could be within a department, or across campus. Think about building off, could there be an opportunity to showcase National Preparedness Month, which occurs in September of every year, or this year even, National Public Health Week in April. One of the day's focus areas is actually on public health emergency preparedness and response. So for this next component, we'd like to share, going back to those three FEP capabilities, what are some examples that we've utilized either in our classrooms or in our experiences that you could modify or use forward, or just examples of how we've taken the FEP capabilities and can translate that into curricular content at the undergraduate or graduate level. So specifically looking at the FEP capability of community preparedness. Within the context of building knowledge of public health systems, healthcare systems, as well as looking at community preparedness levels of assessing functional and access needs. An activity that I've utilized with my students is looking at building out an individual or community level preparedness plan. So this involves that students will reference and start to research the public health emergencies or disasters that are more common in the area where they live, or they can choose an area of, say, the United States that they want to focus on. And then also referencing the CDC's social vulnerability mapping tool as a way to assess potential social vulnerability within the community. So as part of that research, then based on what their findings are, choosing a disaster or public health emergency that is at greater risk of occurring within that community, and developing a personal, family, or organizational level preparedness plan provides a real life application for the research that they've done.
One approach to introducing students to the concept of the FEP capability medical countermeasure dispensing is to introduce them to the points of dispensing, or PODs. One of the most widely used training modules regarding mass dispensing of medical countermeasures is the University of Minnesota's online POD module. This free 50-minute POD module covers the functions of a POD, the roles and responsibilities of POD staff, and the organizational structure utilized during POD operations. One could build off this pod training in a number of ways. One way would be to discuss the incident command system in more detail, as it is the standardized organizational structure and communication system utilized during pod operations, as well as any small or large scale size disaster response. Another way to build off the pod training would be to reach out to your local public health department to inquire about the possibility of inclusion of students in pod exercises or drills. At one local university, students have been involved in pod setup drills and other pod-related exercises over the past several years. The feedback received from students following these drills is that by participating in the drills and exercises, they were better able to process what they had learned by viewing the pod module. Once the curriculum hub is up and running, you can look forward to finding a number of resources directly related to the incident command system.
The third FEP capability and curriculum element we'd like to highlight is related to public health surveillance and epidemiologic investigations, specifically around building skills and knowledge of disaster epidemiology through a hands-on in-class exercise. For this activity, I've utilized in my epidemiology courses, and specifically, it is the opportunity that students can get hands-on application for some of the content that they've used. For this activity, there is a set of CDC disaster epidemiology modules that students have access to and review prior to this activity, which includes introduction to the health impacts of disasters, tools and skills used in disaster epidemiology, and specifically introducing them to the CASPR, Community Assessment for Public Health Response. And then in an in-class activity, we start with an orientation and divide them up into teams, of which then they are asked to go and conduct assessments among community members at fictional communities that have been impacted by a disaster. And we've varied this activity to include maybe communities affected by flooding, by hurricane, and that students will travel, and then based on travel within the classroom setting within 2 different communities and conduct a modified CASPR, which typically it's a assessment that looks at a rapid needs assessment of a community, and they both review community level data about displacement or health impacts, as well as vignettes of community members affected by the disaster. Following this session, they collect all their data that they've put together, and then we have a debrief session of what this might mean in the phases of disaster response of both immediate response, and then longer community recovery. We also wanted to offer some additional resources as the hub is getting up and running to consider if you're looking for additional resources or information on some of the tools and things that we've highlighted so far today. One is the Minnesota Department of Health, both in their Division of Emergency Preparedness and Response, has a variety of resources and information to start building off of. In addition, the Centers for Disease Control, Emergency Preparedness and Response Resource Center offers some, if you're looking to have students develop an individual emergency response plan as a class activity, that there's some frameworks to help get started with that as just an example of some things to start with. The other is the Rural Emergency Preparedness and Response Toolkit. This toolkit is from the Rural Health Network that also includes some case studies, which can be utilized with descriptions, videos of various public health emergency preparedness response, anything from a disease outbreak, vaccinations, to chemical exposure within the community. So then we wanted to talk about what are some next steps or ways, if we hope that you're excited and you're either continuing to build on your work or interested in introducing this work within both any of your roles. The first opportunity to engage is we are offering a series of webinars that are really student focused, but also we would encourage you to attend if you're interested. We're hosting a public health career panel specifically featuring EPR staff within local, state health departments. In addition, we're providing an introduction for both students and staff and faculty to the Medical Reserve Corps and highlighting a local public health person working with the Reserve Corps, and then also an opportunity to build skills and knowledge in crisis communications as our third webinar. These as well will be recorded and we hope as a good resource moving forward for curriculum development. Another opportunity for engagement is the opportunity that if you have an interest and desire to continue to build out skills as we have, or curriculum, as we have a current open sub-granting opportunity to support faculty and staff in developing curriculum. And we've shared some of that out, but are happy to share additional information on that with the first round of review coming in February 15th. The EPR Resource Hub will also be a key resource from the project that includes materials aligning with the FEP capabilities. But if you have any interest in getting involved or learning more, Kathy and I would love to connect with you and share in this work. And we all thank you for the already tremendous work that you do for your students in pursuing their passions and interests, either in public health or other fields. And with that, we would like to open it up for if there were any questions or comments. We have been tracking the Q&A throughout the session, but wanted to pause here and maybe offer it if you have any questions. As we mentioned at the start of the session, is when feel free to pop any questions or thoughts into the box, and we're happy to answer those. We are again very excited that you're here, and we'll take a moment to see if anything comes in the Q&A box. I did want to highlight in the comment section or in the webinar chat, we have shared a link for the registration for future webinars. Like we said, we'd love for you to share with your colleagues, your students, staff that you work with as well, with any of the webinars that are coming up. We also, if there's context or want to receive information about subgranting that maybe you hadn't heard about that, we're happy to share that, as well as any other ways to engage with the project or with Kathy and I and the advisory board. We would again welcome that. But why don't we start with one question I think that is often comes up, or when I've talked to some faculty, I think one of the first questions might be, where do you start? Or where might be a start if you're interested in engaging within the FEP capabilities and including more public health emergency preparedness and response. And Kathy, if you want to share your thoughts afterwards, but I can share some of my initial feedback, is start wherever feels like a skill that you would be interested in your students having. So if it's you teach a health communications course, and maybe it's building out some exercises or analysis of existing public health emergency communications, or talking about crisis communication skills, that there's opportunities even within a single class session, discussion board, or opportunity to introduce those. Kathy, do you have any thoughts?
Sure, yeah. And my experience is including students in public health emergency response drills and exercises. We in public health are the recipients of their energy and their excitement about learning about emergency preparedness and response, and they also learn more about what it feels like to be of service to your community during a public health emergency. So I think those exercises and drills, as we mentioned, could be small in scope, something in the classroom, or again, you could do something campus-wide or department-wide. And again, I'd like to encourage you to reach out to your local public health departments and see if there's any situation or any activity that students could be included in. It's a really rich experience for them.
Great. And I saw one question in the chat was when will the February 27th registration be open? And I would imagine the next few days we will get that registration open. But thanks for that question. We will share it and let people know. Well, with that, we want to thank you so much for taking the time. I know it's precious in your professional world for engaging in this discussion. Like we said, we will have this available on our hub, as well as Kathy and I are available for any questions, consultations. But thank you so much for your time and attention, and have a great rest of your day.
Thank you, everyone.